Hello everyone, my name is Punam Baral and today I'll be presenting my research on ethical governance of artificial intelligence in healthcare with a focus on addressing biases, transparency and patient autonomy. This topic is especially important to me as both a nurse and a healthcare administration student because it directly impacts how we deliver safe, ethical and patient-centered care in an increasingly digital healthcare environment. Artificial intelligence is rapidly transforming modern healthcare delivery. It enables faster and more accurate diagnosis, supports predictive analytics for patient outcomes, and improve efficiency in clinical outflows. However, despite this benefit, the rapid adoption of AI has outpaced governance and ethical oversight. This creates several emerging risks, including algorithmic biases, lack of transparency, and reduced patient control over healthcare decisions. Because of these risks, strong governance frameworks are essential to ensure that innovation is balanced with ethical responsibility and patient safety. Currently, the main regulatory framework guiding healthcare data is the HIPAA security rule. This framework provides important protection for data privacy and establishes security standard for health information. However, one major limitation is that it does not regulate how AI systems make decisions. This creates a governance gap, particularly in areas such as algorithms, oversight, and accountability. As a result, healthcare organizations must go beyond basic compliance and develop more comprehensive governance strategies that address ethical concerns related to AI. Research has shown that bias is a real and serious issue in AI systems. A study by Giat Overmeer found significant racial bias in healthcare algorithms. This bias often comes from historical inequalities embedded in training data and the underrepresentations of certain populations. The consequences include misallocations of healthcare resources and worsening health disparities. This highlights an important insight, which is that AI can unintentionally reinforce systemic inequities if it is not properly governed and monitored. Another major issue with AI in healthcare is the lack of transparency. Many AI systems operate as black boxes, meaning that their decision-making processes are not easily understood. This creates a challenging for providers who must explain and justify clinical decisions. It also raises ethical concerns, including lack of accountability and reduced trust from both clinicians and patients. Key ethical principles such as transparency, fairness, and responsibility are at risk. To address this, there is a need for more explainable AI models and clear documentation of how decisions are made. Let, let's discuss about impact on healthcare providers. AI has both positive and negative impacts on healthcare providers. On the positive side, it improves diagnostic support and increases efficiency by reducing workload. However, it also creates challenges, including dependence on AI outputs and the need for new technical skills. One major risk is over reliance on AI, which can reduce clinical judgment. From my nursing experience, maintaining critical thinking is essential for patient safety. Therefore, governance efforts should focus on staff training, proper integration into workflows, and establishing clear accountability structures. Okay, now let's talk about AI impact on patients. Patients are at the center of these ethical concerns. Major issues include the privacy of sensitive health data, lack of understanding of how AI is used in their care, and the potential for biased treatment decisions. These risks can lead to loss of trust in healthcare systems and reduce patient autonomy. To address this, healthcare organizations must ensure transparent communication, obtain informed consent, and actively involve patient in decision-making processes. The ultimate goal is to maintain equitable and patient-centered care. Okay, so now let's talk about stakeholder responsibilities. Effective governance requires collaboration among multiple stakeholders. Policymakers are responsible for developing adaptive and uh, enforceable regulation that address issues like data ownership and accountability. Technology companies must design ethical and unbiased algorithms while ensuring transparency and accuracy. Healthcare organizations must implement a governance framework and continuously monitor AI performance. The key takeaway is that no single group can address these challenges alone. Collaboration is most important. Okay, what are the government's model and comparison? There are two main approaches to AI governance. The compliance-based approach focus on regulatory adherence and provides structure, but it lacks flexibility. The risk-based approach focuses on continuous monitoring and proactive risk management, but it can be resource intensive. The best solution is a hybrid model that combines both approaches. This ensures accountability while also allowing organizations to adapt on new and emerging risks. Okay, what are the strategic recommendations? Based on my research, there are several key recommendations. Healthcare organizations should use diverse datasets to reduce bias and develop transparent, explainable AI systems. Regular audit and bias assessment are essential. Organizations should also invest in workforce training and strengthen data governance policies. Additionally, patient centered practices such as informed consent and a clear communication should be prioritized. Finally, collaborations across stakeholders is critical for successful implementation. Okay, that will be the end of my presentation. So these are the references that I used to do my research. And thank you. Thank you.